Well, good evening once again. Day 184 of the Biden administration, which is now, as you know, racing to control this latest rapidly worsening surge of virus in our country. This spike fueled by the Delta variant and ripping through communities with large numbers of unvaccinated Americans. And so once again today, the CDC was forced to sound the alarm, calling this a pivotal moment in the fight against this pandemic.
Take the Delta variant seriously. This virus has no incentive to let up, and it remains in search of the next vulnerable person to infect. Compared to the virus we had circulating initially in the United States at the start of the pandemic, the Delta variant is more aggressive and much more transmissible than previously circulating strains. It is one of the most infectious respiratory viruses we know of and that I have seen in my 20-year career. Whether you are vaccinated or not, please know we together are not out of the woods yet.
Dr. Walensky there, the CDC director, says the 7-day average of new cases in our country is up 53% over just the previous week. The areas in red on this map are those particularly hard hit. This is a CDC map. Portions in yellow and blue have moderate to low levels of infection. 3 states, Florida, Missouri, Texas, are home to about 40% of the new cases. Florida continues to lead the nation, of course, in new cases. A research group working with the CDC now projects the Delta variant will cause a steep increase in our daily death toll, likely peaking at around mid-October. This virus surge is yet again pushing a lot of exhausted healthcare workers and hospitals to the brink.
Just feels like we're going backwards. And I know that me and a lot of other people here we are feeling very discouraged, very disheartened, very, in some cases, a little bit angry.
This worsening situation has a lot of people wondering if we're just headed back to the days of lockdowns and other restrictions on life imposed a year ago or more. Today, the White House press secretary was asked about reports that there could be new guidance soon on wearing masks.
What I can tell you is that there has been no decision to change our mask guidelines.
Right now, the CDC says fully vaccinated individuals don't need to wear masks, but those who are unvaccinated should be wearing a mask. President has gotten high marks in national polling, as you may know, for his handling of the pandemic and the vaccine rollout thus far. But as new cases creep upward, the administration is under increasing pressure to find a way to quickly control the spread of this virus. Today, the president said the White House is trying to get ahead of the situation.
We follow the science. What's happening now is all the major scientific operations in this country and the 25-person group we put together are looking at all the possibilities of what's happening now. If you are vaccinated, you are safe. If you are vaccinated, you have over a 98% chance of never catching the virus at all.
The administration is right now surging over $1.6 billion to high-risk areas of our country for more testing, contact tracing, as well as vaccination support, getting shots in arms. As Politico reports, perhaps the biggest challenge is now in states that have made it illegal for local officials to enact certain restrictions to stop the spread of the virus. Many of those states are the ones seeing some of the worst outbreaks. Ron DeSantis, governor of Florida, which today reported well over 12,000 brand new cases, insists he has the authority to cancel local health orders if he thinks they infringe on individual rights. This afternoon, he drew a line in the sand over masks in Florida schools, even though children under 12 still are not eligible for vaccines.
There's been talk about potentially people advocating at the federal level imposing compulsory masks on kids. We're not doing that in Florida, okay?
Officials in Atlanta, Philly, Houston moving in the other direction, beginning to recommend and in some cases require residents to mask up. Overseas, COVID cases are now spiking in Tokyo. Nearly 2,000 reported just today, the highest there in 6 months. truly is a spike. Opening ceremony for the Olympics now just hours away, and so far over 90 people associated with the games have tested positive. I'd like to begin with you, Doctor, only I'd like to change your role a bit in this question and answer from physician more to sociologist. This anti-vaccine movement, the attitude, is a lot of things. It's social, it's in some cases socioeconomic, and it's political. But so far, the siloing of our country, blue and red, rich and poor, liberal, conservative, has not worked. The kind of shaming and lecturing has not worked. How would you go about changing public attitudes when lives are at stake?
Good evening, Brian. Great to see you. This is what I'll say. First and foremost, I think the CDC can recommend whatever it wants. Indoor masking, if they want to pivot, they can recommend that. And certainly some people, I would encourage people to do what they feel comfortable doing. Ultimately, it falls to state governors like Ron DeSantis, state occupational safety and health boards to enact policy, local officials to enforce it. So we need to be clear-eyed here about where we're putting our attention on. We should be focusing, to your point, Brian, your question, how do we get people to uptake the vaccine as quickly as possible? I've been in Fresno just yesterday. I was in Las Vegas or in the suburbs around it last week, speaking to my fellow enlisted members in the military when I've been on base. And what I will say is that people are reachable. We are putting up the white flag suggesting that people are not, that vaccine rates are plateauing. They are reachable. They just want to be spoken to in a simple, non-judgmental way. They have questions. Once we answer them in a non-judgmental way, they're willing to get the vaccine. I've seen it directly with my own eyes. My colleagues have similarly. So we need to scale that personalized engagement and do more of it in an accessible way. And I think we'll get to where we want to be. Debating whether CDC should do X or Y, you just played what Ron DeSantis said. It's not going to work. People that want to mask will mask. People that don't want to mask will not mask. We've already played this and passed this prologue.
Dr. Gupta, I want to play for you part of an interview on this network earlier today with Dr. Hazeltine, the noted vaccine expert, who, as you'll hear, takes a hard line. We'll discuss on the other side.
I would rather see governments say, if it's okay, you don't want to be vaccinated, but then you can't go to the movie theater. You can't go to restaurants. You can't take public transportation. That's what they're doing in France right now. It isn't that there's not pushback there, but that is a reasonable suggestion. Yeah, you're free to get infected and die yourself, but you're not free to infect other people.
All I got wrong was the network he appeared on. That was during the day today on CNN. Dr. Gupta, what do you make of the sentiment of his remarks there?
Well, Dr. Hazeltine is essentially saying that we should mandate the vaccine or have vaccine, and this is a bugaboo word, passports or some sort of certification system writ large. I'm of the mind, Brian, that if we do that for polio vaccine, if we do that for meningitis for kids about to enter college, there is no reason we can't have that same expectation for the COVID vaccine. It is just there's a lot of noise that has, for whatever reason, confused this debate and not allowed us to have proper context. I think he's right. We need to have clear incentives in place. We should be talking about going backwards. We should make it really clear to people. If you're vaccinated, you can do X, Y, Z. If you're not allowed to do those things. And we should move towards mandating for certain parts of the population, including school-aged children. I think you're going to see that in addition to the military.